This is Dr. James with Helpmommy.com, and this is a video for 3-month-olds. I had lots of people go, hey, he just skipped 3 months. He did 2 months, and then he did a series on 4 months. Where's the stuff on 3 months? And the reason is 3 months don't really have something. They're a continuation. It's where you're getting better at something. You're doing more of something, but there's not anything specific for them. So I'll give you the ranges because they're all different. But there's not any hard and fast lines that are going to say, hey, this is what's supposed to happen. There's no real warnings of what's going to happen. They're just doing the stuff that they did at 2 months more and better. And so eating, they should still be only drinking milk, be that formula or breast milk. If they're breastfeeding, they should still be doing their vitamin D drops. And mamas, make sure you're trying to take your prenatal vitamins to protect your bones. We worry about temperatures above 101. They're still susceptible to illnesses, but we don't freak out if they get a temperature above 100.4 and put them immediately in the hospital. But if they did get a temperature above 101, it's probably a good idea to have them seen by the next day. They are still very susceptible to dehydration if they were to get rotavirus or any of the other GI bugs. And they're very susceptible to have severe respiratory problems if they end up with something like RSV. As far as the amount that they drink, it varies baby to baby. I'll have babies that are drinking anywhere from 4 to 8 ounces. Most of them are eating about every 3 hours. Babies that are breastfeeding, probably anywhere from 7 to 15 minutes on each side. Peeing and pooping, lots of pee because they're on an only liquid diet. Pooping is all over the place. I'll have babies that may skip days and not poop for 2 or 3 days. I may have babies that are having 1 to 2 stools a day. I may have babies that are having 4 or 5, especially breastfed babies. They're all over the place. It ranges anywhere it can look like really watery greenish yellow cottage cheese to it could look like kind of like custard or pudding. If it's hard balls, that's constipation. You need to let your doctor know because those are going to be painful. As far as development, they're smiling. They're looking around. They may chuckle in their sleep. A couple early ones may actually laugh, although we usually don't see that until after 4 months old. They're starting to develop their personalities. They recognize you. They get excited when they see you. And that gets more and more as they're going along. They're looking around. They're trying to explore their environment. They start to reach for things. They may actually try and reach for you. Sleeping, they should still be only sleeping on their back. They shouldn't have anything in their crib. They should be facing backwards in the car seat. They shouldn't have any solid food. They shouldn't be getting any water or juice unless specifically directed by a doctor, usually for constipation. They're just exploring their environment and they're cute little babies. This is when they're getting chunky. They get big old cheeks. They get rolls of fat. This is when we call it, the little fat rolls and stuff like that. Baby fat. This is when they get their chunkiest, is somewhere around that 3 to 5 months. These little babies just have wrinkles and they're so cute. They're sleeping. Some of them are sleeping through the night. Some of them are still waking up every 3 hours. Again, there's not anything specific, and there's a huge range of normal. So the important thing to know about 3 months is it's the continuation from 2 months until 4 months. But there's not any specific things that absolutely happen at 3 months, other than hopefully you've started to get into a little bit of a rhythm. You enjoy your baby. You're getting good at being a parent, probably pretty fast at changing clothes and changing diapers.